Hello, my name is Angelica Curiel and I will be giving a presentation on borderline personality disorder. What is borderline personality disorder? BPD is a mental illness whereby individuals with the condition have difficulties in regulating their emotions. After an emotionally triggering event, people with BPD experience intense emotions for an extended period and they take a longer time for the emotions to return into a stable baseline. Due to the presence of volatile emotions, their relationships with other people are unstable and they have a poor self-image. In extreme cases, people struggling with self-regulation due to BPD can adopt dangerous behaviors such as self-harm and suicidal ideations. Individuals suffering from BPD are extremely sensitive and small issues can easily trigger intense reactions. In some instances, it is difficult for these people to think straight and cannot stay grounded for prolonged periods. They experience emotional volatility and they can hardly soothe themselves and can practice reckless behaviors. Common symptoms of BPD include the fear of abandonment, the presence of unstable relationships, unstable self-image, self-destructive behaviors, emotional swings, feelings of emptiness, and anger. Once a professional has identified the disorder, effective treatment is possible through psychotherapy. It is a process where the patient is taught how to deal with emotional dysregulation. In some instances, medication is necessary since it can control various symptoms such as mood swings and anxieties. Physiological effects of borderline personality disorder. People who struggle with BPD experience fight or flight reactions, often causing the hypothalamus to release stress hormones. Those with BPD struggle to control these heightened senses, and this is due to the inability of the salience network to modulate the hypothalamus. When these patients experience stress, they also demonstrate elevations in cortisol levels along with hypothalamic volumes. They may also show abnormal activity in the lateral and medial areas of the prefrontal cortex, which help control emotional responses. A disconnection has been found between the ventral prefrontal cortex, dorsal medial prefrontal cortex, and the amygdala, but they continue to function regardless of the disconnection. Structural changes have also been observed in the limbic and prefrontal areas of the brain. Volume reduction has also been observed in the hippocampus, amygdala, and cingulate gyri, but also showed greater activity coming from the somatosensory cortex and amygdala. The poorly modulated and overactive amygdala may explain the patient's dominant focused attention on what seems threatening to them. When it comes to neuroimaging, the sulcus and superior temporal gyrus had less activity as opposed to a healthy individual. Those with BPD seem to experience emotional contagion, more so with negative facial expressions, and this is shown by electromyographic data. Statistical facts of BPD. Borderline personality disorder disproportionately affects women more than men, racking up 75% of identifiable cases. This statistic can be due to men being misdiagnosed with depression or PTSD. Approximately 1.4% of the US adult population is diagnosed with BPD. 10% of adults struggling with BPD commit suicide. Between 33 to 85% of adults diagnosed with BPD physically injure themselves. Approximately 68% of the population diagnosed with BPD inherit the disorder from their family. Statistics of economic impacts of BPD. Around 40% of those diagnosed with BPD frequently use mental health services. It is estimated that 38% of those impacted by BPD struggle with substance abuse. Approximately 50% of those that are severely affected by BPD struggle to be employed. In regard to prison populations, about 17% of inmates suffer from BPD. It is estimated that 38% of those impacted by BPD struggle with substance abuse. Treatment for borderline personality disorder. Dialectic behavioral therapy was first designed by Marsha Linehan with the intent to help those with chronic suicide ideation, borderline personality disorder, and complex trauma. This, like any other psychotherapy, takes time and the patient is taught skills to integrate in their everyday life. DBT is also referred to as cognitive behavioral therapy or CBT. Dialectics help the client understand the difference between a thesis, antithesis, their ability to simultaneously exist, and learning to find the middle area between the two. The foundation of DBT lies in acceptance and change. The therapist helps the patient accept any negative emotions that hold them back and to learn to use those emotions as motivation to make changes in their life for the better. As the patient is learning to accept their emotions, the therapist continually uses persuasive dialogue to encourage and convince the patient to make these beneficial changes in their everyday life. The patient is questioned throughout the development of the therapy to help them analyze themselves and what they feel, what they think, and how they behave in an objective manner without condemning themselves. The purpose of DBT is to improve the patient's abilities, encourage the usage of their abilities, establish a generalization of the patient's abilities outside in the real world, improve the therapist's motivation tactics and skills in therapy, along with constructing an environment which supports the progress of therapy. To accomplish the optimal progression of DBT, the patient must attend individual therapy at least once a week for an hour, attend group skills training for at least 2.5 hours, access to the therapist to help coach through situations that occur in vivo, and a consultation team to help keep the patient's commitment and constancy to their therapy regardless of who is helping them through the process. As once stated, the process is long and at optimal therapeutic progression results are observed after a year, since in the first 6 months skills are persistently taught, and in the following 6 months those skills are applied on everyday life and modified to make improvements. These are my references, and this concludes my presentation. Thank you.